Hello, my name is Jared Sile. I'm a captain with the Lufkin Fire Department. I've been with the department for right at 20 years now, and I will spend a majority of the time on the med unit on the rescue truck. I'd like to talk to you today about a few things that are important pertaining to diabetes that we see all the time. With diabetes, we get called to a lot of people who are confused and disoriented and really don't know what's going on. So I think it's important that we talk about medical identification, and so that people, if they find you in a state of mental confusion and altered mental status, that they can help get you the help you need. One of those things is a medical ID bracelet. You may have seen them. They're bracelets that you can pick up at your local drugstore or Walmart or even Amazon or online. You get those and they'll have identifiers on them that will let people know that you are diabetic, and they might can get you the help you need. There's also, you can possibly get some cards to put in your wallet. That way, in case you're ever pulled over on the side of the road or something like that, an officer might be able to see that when he checks your driver's license, and then he may be able to get you the help you need. One item that we have that we don't utilize a lot is our phones. On your lock screen, you have emergency info. If you'll fill that information out on that, when a first responder responds to you, he may be able to check that and see, and you can put your allergies on there. You can put things like diabetes, contact numbers, and things like that. So it's important to fill that out. Just in the off chance that they do see that, it'll provide some much needed information. Let's talk about why it's important to have these identifiers. One of the things about diabetes is when your blood sugar drops, it causes issues with your mentation. Some of like altered level of consciousness. You may show many signs and symptoms that are similar to being under the influence of alcohol or other substances. You'll have unsteady gait. You may stumble. You'll be lethargic. You may appear like you don't want to wake up. In some cases, people become combative. And like I say, a lot of these things are the same signs and symptoms as someone who has had too much alcohol. All right, so if you get pulled over because your blood sugar is low, you will show those signs. And so an officer, especially, he may assume that. Okay, so it's good to have these identifiers, medical identifiers, that will help them get you the help you need. Another thing too to point out is family members. If you happen to have a family member who is diabetic and you call EMS for these signs and symptoms, and want to help, let your dispatcher know that the patient is diabetic, and that helps rule out other possible issues and helps them focus on that possible problem and give you the help you need. Some of the confusion with diabetes, the confusion between diabetes and being under the influence of alcohol or other substances, is with your diabetes you get confusion, you get an altered mental status, you get unsteady gait, sometimes you can't be woken up, and in many cases you become combative. So as you can see, these are things that are very common with too much alcohol and stuff. So it's good to get that information out there, wear your identifiers in case you're in that state, because you won't know what's going on, and you can and so your helpers can the responders will be able to get you the help you need, and maybe it will keep you from instead of ended up in a drunk tank, you might be in the hospital where you need to be.